Darla jumped when the ghost popped out of the bushes. "I can't believe I'm scared," she thought, heart pounding. "It's Halloween. That's just someone dressed up like a ghost." Everyone gets scared sometimes. It's a normal reaction. You need that reaction to survive. When faced with a threat, it's useful to be afraid and get out of the way so that you won't get hurt. You can also learn fears through experience. Greg, for example, once fell off the ladder. After that, he was afraid to climb the ladder. He finally realized all he had to do is be careful when using one. As you get older, you may outgrow some fears. Maybe you used to be afraid of the dark or of spiders. Different people are afraid of different things over time. Fear or phobia? Fears can be mild or severe. Mild fear just makes you feel slightly nervous. But intense fear can make you sweat. Your heart may beat faster. You may even have trouble breathing. Sometimes fear becomes extreme and unreasonable. This is known as a phobia. Phobias are fears that make people feel out of control. Sometimes people with phobias feel sick. Some of them get headaches, high blood pressure, ulcers, skin rashes, nausea, or other medical problems. Ken had a phobia about dentists. He felt ill if he had to see one. He got sweaty, threw up, and had trouble breathing. He would do anything to avoid going. Doctors believe that most of those phobias, like Greg's, are learned. But in some cases, a phobia follows an unrelated trauma, such as a death in the family. And the tendency to develop some phobias may run in families. Extreme fears. Phobias can be about things, activities, or situations. For example, people can have phobias about cats, storms, or heights. These are called specific phobias. Other people may be afraid of going to parties or being with other people because they think they would feel judged, embarrassed, rejected, or scared of offending people. Such a phobia is known as social anxiety disorder, or social phobia. Tess, for instance, would not play with other kids. And she sweated, blushed, and stammered if she had to speak in school. Still, other people have a type of phobia called a panic disorder. They suddenly feel very frightened for no reason. They may sweat, tremble, faint, have trouble breathing, or get very sick. Worst of all, they never know when a panic attack will strike. Phobias often have weird names. Some examples are arachnophobia, fear of spiders, brontophobia, fear of thunderstorms, claustrophobia, fear of enclosed spaces, myxophobia, fear of slime, and arachibutyrophobia, fear of peanut butter sticking to the roof of your mouth. Taming the fear. If a phobia interferes with daily life, it's time to do something about it. Psychologists have several suggestions for dealing with phobias. Talk about the phobia with someone you trust. Breathe deeply, and try to relax when you think about the thing you fear. Try to visualize what you fear to lessen the phobia. Try to think positive thoughts. Replace "I'm so scared" with "I'm going to be okay." Slowly count to 10. Tell yourself you will be alright when you reach 10. If these things don't help, see your doctor. He or she may refer you to a psychologist or psychiatrist. These experts can help you learn to overcome a phobia. Sometimes they use a method called systematic desensitization, systematic desensitization. This involves getting used to something one step at a time. Hannah saw a psychologist about her fear of dogs. The psychologist had her face her fear in stages. First, Hannah relaxed. Then, she imagined she was near a friendly dog. Third, she looked at pictures of dogs. Finally, she went up to a real dog and patted its head. Another useful technique is virtual reality exposure. Carl overcame his fear of flying this way. He sat in a computer-controlled virtual plane that never left the ground. He experienced takeoffs, landings, and flying in all kinds of weather. It's important to realize that phobias can be treated. Most people who seek treatment completely overcome their fears for life, according to the American Psychiatric Association. This is true even if your fears are worse than the usual Halloween jitters.